So elotuzumab is an antibody directed towards SLAM7, just like I had shown before. But the one extra sort of bonus about elotuzumab is that it further activates the NK cells to destroy the myeloma cell. So it helps bring the good guy to the bad guy to do the destruction. And so it helps activate this. And SLAM7 is not found on other cells. So again, it's another one of the smart cruise missiles that can go after myeloma. It did nothing by itself, and then when they combined it with Revlimid and dexamethasone, it had incredible responses. So in this trial of a bunch of people, 600 people, they got randomized between Revdex and Elo-Revdex. And I should mention that the antibodies are given IV. Both antibodies are given on a weekly basis for 8 weeks. So you come in once a week for 8 weeks. Then after 8 weeks, then you go every other week for either 8 sessions with daratumumab, or every 2 weeks for as long as you want to with elotuzumab. Eventually you get to a monthly kind of maintenance therapy. But with Elo, they give you kind of an open book to when to start the maintenance therapy. So you either get Elo or Revdex until to see what happens. And again, elotuzumab outperforms Revlimid dexamethasone. Elo outperforms Dex. Elo outperforms Revdex. And again, we have these great response rates that are superior to Revdex alone. The one thing that Elo has going for it is that the response rates are comparable to Dara, very high response rates, love it. But it is really, really, really long lasting. So the median time to the next relapse was 33 months. And there's still a lot of patients who are on this trial after 3 or 4 years that are still on elotuzumab. The other thing about this antibody and daratumumab is that both the high-risk myeloma patients, the ones that are very difficult to treat, the ones because the disease can become so resistant, none of the antibodies care about risk. These are all risk-agnostic treatments. So if you have high-risk myeloma, it'll destroy you. You have low-risk myeloma, it'll destroy you. It doesn't care about risk or how long you've had the disease. And that's a great thing. The response was seen in all subgroups. And again, it was kind of the same things, that the first reaction, the first infusion is a little bit difficult. I would say between the two, Elo is easier to give. There are less reactions. And again, with quality of life studies, no difference in quality of life. So the people who are taking Revdex or taking Elo-Revdex were both feeling perfectly fine. Elotuzumab, again, did nothing by itself, but when you combine it with the immune enhancer of elotuzumab, of Revlimid, response rates are 80%. When you combine it with Velcade, again, response rates are in the 60 percentile.